Time. Good afternoon. Good afternoon. There we go. All right. I'm going to begin by thanking David Jones and Jen McElroy for sign language interpretation today. Usually I introduce them last, but today they get to be first. Today I'm joined by doctors, social workers, and staff from the trauma unit at Stroger Hospital. Today is National Gun Violence Awareness Day. We're wearing orange in honor of Hadiya Pendleton, who was killed in Chicago in 2013, 6 blocks from my house. This is a somber day in commemoration of an especially somber 2 weeks. Today reminds us that gun violence is still a pandemic, one that our nation has yet to address. Many have suffered, many have died, including Hadiya Pendleton. Hadiya was only 15 years old when she was killed. We mourn her senseless death and are grateful to the Pendleton family for channeling their grief into raising awareness of gun violence. People across the nation are wearing orange today, raw and hurting from so much that has happened recently. We wear orange because we are exhausted by the senseless killings. We wear orange because we are tired of lawmakers who listen to the National Rifle Association instead of the parents of Sandy Hook, Columbine, and the countless other schools that barely make the news. Our region is no stranger to gun violence, and we know that gun violence has increased during the stay-at-home order. In 2019, Cook County Health treated 354 gunshot wound victims between January 1st and June 2nd. 354. For that same period this year, Cook County Health has cared for 425 patients with gunshot wounds. This represents a 17% year-over-year increase, despite the fact that we've been under a stay-at-home order for 72 of those days. We know that people are tense and anxious, with the highest unemployment rates in our nation's history, and families worried about where their next meal or their next rent payment will come from. It's no wonder that some, in their hopelessness, turn to violence. That's why in Cook County, we have called gun violence what it is, a public health crisis, a pandemic. And like any other crisis, it needs to be treated at the root cause. We need to treat more than just symptoms. We have to invest in the communities devastated by violence. But first, we must recognize that they have been devastated by structural racism, disinvestment, and neglect. The root cause of violence is often trauma based on entrenched poverty, unemployment, food insecurity, and the generational trauma of children with incarcerated parents. At Cook County, we treat this crisis with medicine, and we fund programs across the county to stop violence before it starts through our Justice Advisory Council. We fund STEM educational programs such as Southworks Robotic and Engineering Olympics in the south suburbs run by OAI, one of our grantees. We fund restorative justice programs throughout the south and west sides of the county. The research and success stories from all of these programs indicate that restorative justice practices repair harm, avoid unnecessary incarceration, and end cycles of violence that could escalate into gun violence. Grantees like Habilitative Systems teach restorative justice on the west side of the city of Chicago in Austin and Garfield Park. We also fund mental health programs like the one administered by UCAN, recognizing that many people commit acts of violence out of past trauma that has not been addressed. Funding community-based programs focused on violence prevention, stopping the gun violence before it starts, restorative justice, recidivism reduction, investing in communities instead of jails. That's the public health approach we will continue in Cook County. They say that nothing stops a bullet like a job, and that's true. If you look at the maps of poverty and gun violence in Cook County, such as the one that Ready Chicago published in 2017, the zip codes with the highest poverty rates have the highest levels of gun violence. I'll say that again. The zip codes with the highest poverty rates have the highest levels of gun violence. This moment requires each and every one of us to recognize this problem for what it is, and to get civically engaged, stay engaged, advocate for gun reform. If you have the resources, take a moment to donate to just one of the many wonderful organizations we support through the Justice Advisory Council, especially those that work to prevent violence, such as Erie Neighborhood House, St. Leonard's Ministries, Emoja Student Development, and Mikvah Challenge. Honor the memory of Hadiya Pendleton and do whatever you can. Donate, volunteer, talk to your neighbors, talk to your legislators to stem this pandemic before it takes any more lives. I want to acknowledge Deborah Carey, who's our interim CEO, who's with us here today, and introduce a member of her staff, Farhan Bokhari. Did I do that right?
Very good.
All right, good, thank you. Chairman of Trauma and Burn Unit at Cook County Health, and I want to apologize to him publicly. Several years ago, we went to Washington on a trip, and we lost him. And I have felt badly about it ever since.
I didn't think that was a by chance thing. Thank you, Ms. Preckwinkle. My name is Dr. Farhan Bokhari. I've been a trauma surgeon for more than 20 years and have led the trauma department here at Cook County Health for the past decade. I'd like to thank President Preckwinkle for coming here today to join the trauma team at Cook County to shed some light on this major public health issue, gun violence. This has been with us for 50 years, as far as I can remember. Cook County Health has a 180-year history and mission to address racial inequality, health disparities, and violence. It's more important than ever to talk about gun violence at this point, as we have distractors all over the political spectrum right now. Each summer, our trauma staff braces for an increase in violence. We've been doing that since 1966. Just a few weeks into this summer, as was mentioned, we've already seen increased levels of violence, loss, and sadness. Even during the stay-at-home order, we saw an increase in penetrating trauma, which is gunshot wounds. Every day, we are seeing the impact of that violence and tragedy has on the families and communities we serve, and how it affects them for generations. This is not the story of one person getting shot. It is the entire family that's getting shot. As the chairman of Trauma at Cook County Health, I stand before you to make a plea to cease gun violence. We are losing family members, co-workers, community members. I urge every person to join us in looking for solutions to make it so that the summer violence in Chicago is not an inevitable conclusion. These solutions start at home, and they start with one person. You don't need a big organization to do this. Thank you very much.
Thank you, Dr. Bokhari. Next, I'd like to introduce Reverend Carol Reese, who's the Violence Prevention Coordinator at Cook County Health and co-director of Healing Hurt People, Chicago.
Thank you, Madam President and Dr. Bokhari, for your support and leadership. My name is Carol Reese. I'm the Violence Prevention Coordinator and Chaplain in the Department of Trauma and Burns here at Cook County Health. I'm also the co-director of Healing Hurt People Chicago. During the past 15 years here, I've worked with countless young people and families whose lives have been ripped apart both physically and emotionally by gun violence. While we see incredible levels of resilience in the survivors we work with, expecting them to continue their path to healing in this environment and alone is an unfair burden, particularly on our young people, their families, and communities. We know that systemic racism, lack of opportunities, and social determinants of health are underlying issues that must be addressed to fully make an impact on the epidemic of violence. And in these days, specifically, people are exposed to unprecedented level of trauma as we experience single events of trauma in our lives, along with the complexities of complex community violence, racism, the historical trauma of slavery, and the emotional and physical impact and toll it takes on us as we try our best to take care of each other. Our Healing Hurt People Chicago team here and at Cook County Health works with survivors of community violence to reduce re-injury, criminal justice involvement, and retaliation. Many of our clients are at increased risk for death, with many studies showing that within 5 years of being shot, 45% will be re-injured and 20% will be dead. Not to mention rates of PTSD as much as 7 times that found in the general population in the United States. Even with all of this, our young people are working with our staff virtually, attending support groups virtually, and staying safe, with 85% of them avoiding re-injury, 97% choosing a pathway other than retaliation, and more than 80% able to avoid criminal justice involvement. This is all a long way of saying that it is possible to make a difference by standing alongside each other and working together. We must all do the work to make fundamental changes to address our society's inequities. So in honor today of Hadiya Pendleton, a 15-year-old Chicago high school student killed by gunfire, in honor of Ahmaud Arbery, an Atlanta man gunned down while jogging, and in honor of all the Black and brown bodies senselessly killed by gun violence in our city this past week, we have come together to ask you to peacefully stand with us against the violence and hatred in all its forms. And now we pray, may the fires that burn our streets ignite fires in our hearts and our minds, that we may not only see and hear the truth, but speak the truth. Amen.
Amen. And again, I'd like to acknowledge Dr. Francesca Bryan, who's a research fellow and works with Dr. Bukhari. Our next speaker is Sharon Mitchell, Deputy Director of the Illinois Justice Project.
Thank you, President. Good afternoon. My name is Sharon Mitchell. I'm with the Illinois Justice Project. I want to thank President Preckwinkle for allowing me to speak on this very important day. Gun violence is so confounding. It takes away the peace of people in a most violent way, and our first response should be mourning the victims and comforting the survivors of gun violence. However, it has also been a problem which we have been comfortable with the solutions that have not worked. That's why I'm proud to be standing with a leader who is not only willing to frame this as a public health epidemic in her speeches, but also willing to support educational programs, justice programs, and intervention programs that can stop the violence before it happens. A few months ago, someone shot a gun in front of my house. Luckily, no one was hit, but I lamented about that day to this day. I wanted the person, the individual, to be stopped. I did not want him to be able to inflict any more pain on any more people. But more importantly, I didn't want there to be shooting in front of my house. Putting someone away should be a concern, but making sure the shooting doesn't happen is significantly more important to myself, my family, and my friends. I want our budget and our priorities to reflect this, and I feel honored to be standing with an elected leader who's making this happen every day. I call upon our leaders in the General Assembly, in Congress, the City Council, and the Board of Commissioners to pass laws, but also create budgets that value prevention at the same level that they value punishment. Finally, I'd be remiss, given this time, if I did not talk very briefly about the thousands of people, 1,000 people that are killed each year at the hands and knees of police in America. With that, we can count the amount of individuals held accountable by a murder conviction with our fingers. We should not be ignorant that people, our community, are very aware of this fact, and it has an effect on how community engages with law enforcement. Legitimacy, trust, and comfort are all wrapped together. We will struggle to keep ourselves safe if we do not have that trust, comfort, and legitimacy. I thank the President for her work, and I mourn with the victims and try to comfort the survivors of gun violence. I feel glad that we are working with individuals in this room who are building a society that will reduce gun violence across the county. Thank you.